Welcome to the reproductive system disorders. We're going to be talking about few specific reproductive system disorders. Let me start with the female reproductive system disorders, and let me start with the pelvic inflammatory disease. Pelvic inflammatory disease is a serious condition, and the clinical manifestations of PID are lower abdominal pain, lower abdominal tenderness, fever, cervical motion tenderness, plus vaginal discharge. So lower abdominal pain, tenderness, fever, cervical motion tenderness, very characteristic, plus vaginal discharge. This is going to point to pelvic inflammatory disease. Now, a differential diagnosis of pelvic inflammatory disease is the simple urethritis and cervicitis. What do we get in urethritis and cervicitis? We get vaginal discharge. And this vaginal discharge is the same as we get in pelvic inflammatory disease. So what is the difference then? The same causative organisms of pelvic inflammatory disease will simply cause urethritis and cervicitis, and this will lead to vaginal discharge, gonorrhea and chlamydia. Gonorrhea and chlamydia can cause simple urethritis, simple cervicitis, or they can cause pelvic inflammatory disease. And also pelvic inflammatory disease can be caused by pelvic anaerobes. So urethritis and cervicitis will result in vaginal discharge, but when you have only urethritis and cervicitis, they will not cause fever, and there will not be any cervical motion tenderness. So simply to diagnose urethritis and cervicitis, what do you need? You need to swab for stain and white blood cell count and culture and DNA testing of this discharge. So blind vaginal swab for nucleic acid amplification testing is just as accurate as the speculum examination. And the treatment of urethritis and cervicitis is simply going to be one gonorrhea drug, one chlamydia drug. One gonorrhea drug, ceftriaxone intramuscular, is the best. One chlamydia drug, azithromycin or doxycycline. So this is the urethritis and cervicitis when they are caused by gonorrhea or chlamydia. How to treat it? We have to give both. One gonorrhea drug, ceftriaxone, one chlamydia drug, azithromycin, doxycycline. The best testing for pelvic inflammatory disease, what's the best initial test? You have a patient with female with lower abdominal pain, please do pregnancy test first, because this could be tubal pregnancy and this results in lower abdominal pain and tenderness. So the best initial test for a suspected case of pelvic inflammatory disease is pregnancy test. The most accurate test is laparoscopy. But I did not say that you have to do it every time. Laparoscopy, we only do it after recurrent and persistent PID. Recurrent and persistent PID, then I have to look inside to see what's the cause of recurrence and persistent PID. White blood cell count will show leukocytosis, and the nucleic acid amplification test can be done on a blind vaginal swab. Complications of pelvic inflammatory disease is infertility and ectopic pregnancy, because the inflammation will lead to loss of the ciliary action in the fallopian tubes and fibrosis and scarring and narrowing and even occlusion of the fallopian tubes, so the ovum will not make it and the sperm will not make it to fertilize the ovum. You get infertility. And if sperm could make it and fertilize an ovum, this ovum could be implanted wrongly inside this scarred narrow fallopian tube, and we can get ectopic pregnancy. Treatment of pelvic inflammatory disease, if you're treating the patient on an outpatient basis, then it's ceftriaxone intramuscular or doxycycline oral. Inpatients are treated with cefotitan, cefotitan against pelvic anaerobes, doxycycline, and even maybe metronidazole. So our case study is about a 19-year-old female who reports a 2-day history of lower abdominal pain, nausea, emesis, and a heavy malodorous vaginal discharge. She has been sexually active with only one partner for the past 8 months, and she admits to unprotected sex every once in a while. So identify 2 risk factors that predispose this patient to pelvic inflammatory disease. These 2 risk factors are sexually active adolescent female and does not always engage in safe sexual practices. Can a diagnosis of pelvic inflammatory disease be made based on the clinical manifestations of the illness? Yes, it can most certainly be made on basis of the clinical manifestations, because all three minimal criteria, which are the lower abdominal tenderness, adnexal tenderness, which is cervical motion abnormality, and cervical motion tenderness, these are present. And at least one other clinical criterion, temperature elevated, this patient has fever, has been established. So yes, we can diagnose PID based on the clinical manifestations here. Which type of infection is suggested by microscopic examination of the vaginal discharge and other lab tests? Chlamydia, gonococcal, or mixed? Since the patient's complement fixation test for chlamydia was negative and vaginal discharge revealed gram-negative intracellular diplococci, this is gonorrhea. This is gonorrhea. Should this patient be hospitalized and promptly given intravenous antibiotics? What do you think? Since the patient has high fever and has reported an episode of vomiting, hospitalization and treatment as an inpatient are necessary.